Hello, welcome to JoyMed. I'm Melina Davis. I'm your host, and today I am so excited to have with me the Commissioner for the Department of Behavioral Health for the state of Virginia, also known as DBHDS, and Commissioner Daryl Washington is here. We're so glad you're here.
Oh, thank you for having me.
Yeah, I'm looking forward to this conversation. As you know, behavioral health to me is super important, and a lot of work we've been doing around that is so instrumental, and it's really helped physicians a lot. So I know they're going to be interested too. I ask that you indulge me because I want to read your bio. Okay, so I'm just going to brag about you a little bit. Daryl Washington, Commissioner of the Virginia Department of Behavioral Health and Developmental Services. He started in January of 2026 and was appointed by Governor Abigail Spanberger, our first female governor. We're so excited about that. And you are the Commissioner of DBHDS. It's a state agency that operates 12 state hospitals. I don't think people really know that. And centers with over 6,500 employees and oversee about $2 billion. Annually, you serve 200,000 Virginians and families with behavioral health disorders and developmental disabilities. Prior to joining DBHDS, Daryl served as Executive Director of the Fairfax Falls Church Community Services Board, or a CSB, if people know that term, a role he was appointed to in 2018. In this role, he was responsible for overall operations at the CSB, which is the Public Behavioral Healthcare and Developmental Disability Service Agency in the county of Fairfax and cities of Fairfax and Falls Church. That's a big county and area with another big important job. I see why the governor appointed you, by the way. And prior to serving as executive director, you also served as deputy director of clinical operations for the CSB. I could go on because you're also a clinical licensed social worker, and you've done that for 30 years. You bring a lot of experience to this job.
I try to bring a few years' worth of experience to the table. Yes.
We don't always get that, by the way, and we're thrilled. And tell me about working with the CSB. I'm really curious about what it is that drew you there and what you think is so important about community service boards.
I think I just have a passion for the public behavioral healthcare system. I started my career working in the school system as a social worker, and I very quickly went back to working in behavioral healthcare agency because that's kind of where my love and my passion lies.
I love that so much. And when you were growing up, is this what you thought you were going to do?
No, actually. It's not even what I originally went to college for. I was good at math and science, and like a lot of people, need to go be an engineer. So I didn't work out that way. So,
well, lucky for us.
Yes.
Tell us what you're most passionate about now that you have this job as commissioner and what you're hoping that you can do in the role.
I guess, the cookie cutter answer would be I'm passionate about everything because every day I get to wake up and work with a great team and really try to problem solve ways to have our public behavioral healthcare system and system that supports individuals with developmental disabilities work better for all of Virginians. And to me, if that doesn't get you excited, what does? So
I love that. I love the service part of your work and that you've dedicated your whole career to it. Tell us about DBHDS. Some people don't know what the department does, haven't heard about it, and it's certainly a lot of letters.
Yeah, I think the Department of Behavioral Health and Developmental Services has a number of critical roles that it plays in the Commonwealth. One is, as you mentioned in my bio, we operate 12 facilities across the state. So I think that is one huge role where that is sort of the safety net, if you will, where folks that can't be served anywhere else in the private behavioral healthcare system, they come to us and to be served by the department. The other role is to partner with and to license private providers throughout the Commonwealth. So, one big role is we license behavioral health care providers and providers of developmental disability services. And I think we're responsible for, ensuring that those providers are meeting a certain standard and quality care,
Mhm.
and that they're able to provide those services to Virginians across the Commonwealth.
Mhm.
And I think, we talk a lot about behavioral health care, but another critical role is, working with individuals with developmental disabilities, making sure they're getting the care and the needs they need in the community as well.
Yeah, I
Mhm.
love that. It's, such a time in our country where I think what you work in and these needs are greater, I think, than any time in recorded human history. Is that
Mhm.
your perception too?
Well, I know the challenges that we're facing here in the Commonwealth are challenges as I meet my colleagues that do this across the country. Um, Many other states are faced with these same challenges
Mhm.
of the
No doubt.
state hospital systems bursting at the seams.
Yes.
How do you find creative ways to provide community care
Mhm.
to those individuals? Because, you know, we don't want to be serving individuals in institutions. There are going
Mhm.
to be always individuals that need hospital stays, but like primary healthcare hospitalizations, that should be time limited
Right.
and should be focused, and you should go there to get the care you need, and then as quickly as possible transition back to the community,
Mhm.
because you may get care in the hospital, but I truly feel like you recover and get better over the long term in the community.
Yeah, especially with people you know around you, your family nearby. I do think Virginia isn't special in this way. The whole country is sort of dealing most of the world is
Mhm.
dealing with some of these stressors. Do you and your team feel like you've got enough resource to handle all the demand?
Well, I've learned a long time ago from working in local government and now in state government, it's you could always use more resources.
Yeah.
I do feel like I have the support of executive leadership in the state,
Yeah.
and I also feel like I have a huge, just well-working team at the Department of Behavioral Health, and a number of community providers that are very passionate about the service they provide and
Mhm.
providing care to Virginians. And to me, that's a great first start,
That's huge.
but we could always use more
Yeah,
resources. Yeah.
absolutely. What do you think is really working in the state? And then the next question I'm gonna ask you, just as a preview, is what do you wanna work on and improve and do work on next?
Yeah. So, I think over the last few years, there's been a significant investment in our behavioral health crisis services continuum.
Mhm.
So I think we've made tremendous strides with that, with the federal government sort of standing up 988.
Mhm.
But now we have, across the state crisis call centers and the ability to dispatch mobile units for individuals in the community that are having a behavioral health care crisis. We're in the process of standing up crisis receiving centers, which is a
Wow.
24/7 model, but it's a lower level care than a hospital across the state. And I
Mhm.
think one of the challenges is we are in transition.
Mhm.
That system isn't fully built out yet. And how do we continue to provide the care that Virginians need during this transitional time where we are still building out our crisis continuum and
Yeah.
moving from a system of care that might have relied too much on hospitalization now to a
Mhm.
system of care that's able to serve more individuals out in the community.
That's really good.
Mhm.
My guess is that the police force appreciates the development of this too, because they need partnership in this area,
Yeah.
right?
Law enforcement are often the first responders
Yeah.
for individuals experiencing a psychiatric crisis, here in Virginia as well as nationwide.
Mhm.
And I think we've been able to train a number of law enforcement individuals in CIT training, which is a
Mhm.
national model that's was started in Memphis, and
Okay.
that's based basically on how to interact with individuals that might be experiencing some type of mental health crisis. At the same time, that's not why they went to the academy.
Sure.
And our goal is to try as quickly as possible, when safe and appropriate, for there to be a handoff from law enforcement into some
Mhm.
type of behavioral health care, mental health care professional, and
Mhm.
have us be able to step into that space and be
Mm.
working with individuals in a crisis and then helping to navigate to the correct level of care that individual needs.
Yeah, that's so important. We're finding that physicians in the emergency department also need more training in this regard.
Mhm.
And sometimes people just get stuck waiting because the services
Yeah.
aren't available as well, right? So they're almost sandwiched between these two
Yeah. So
groups.
one of the things that I've done, and I'm guess a little bit past 100 days into my role, is really visiting those parts of the state that are most unlike Fairfax. So
Yes.
visiting rural Virginia and meeting with the community services boards there, meeting with my staff that work in the facilities, but also meeting with private hospital systems because they
Hmm.
are a critical part of the system of care. And um, each one is unique. They have their own challenges, but some of the common things we're seeing is that in emergency rooms, they are staffed with very qualified primary healthcare docs,
Hmm.
but there's not necessarily that psychiatry specialty
Right.
in the emergency rooms, even of our hospitals. And,
Hmm.
I see that as an area where we could collaborate with our private hospital system to find a way to start intervening with individuals
Hmm.
as quickly as possible in the emergency room to see is
Hmm.
how can we develop those partnerships and get those individuals that do show up in the emergency room that are in crisis, to some type of place where maybe they can get on medications quicker, or maybe they can get
Hmm.
some type of intervention there where we can still steer them away from a hospitalization. Because
Right.
just because you go to the emergency room doesn't mean you have to automatically go to a hospital
Stay.
as the next step.
Right, right. Some interventions.
Mhm,
We've done this with some children's behavioral health, same thing,
mhm.
where we've had to train and provide those bridge resources and that bridge knowledge
Yes,
so they feel comfortable, but they can extend that care because of that knowledge and training.
yes, yes.
I love this work. This is
Mhm.
exciting. What other gaps do you see that you wish you had resource for that want to work on next?
Well, as I traveled around the state and, it I had heard about it, but it wasn't a huge surprise, but it's sort of like there's some parts of the state where there are just huge sort of basic behavioral health care gaps in our systems, where if the CSBs are not providing a service in those communities, the service doesn't get provided on
Mhm.
and things as basic as outpatient therapy
Right.
and then trying to find individuals that have the skill set and the competence to be able to prescribe psychiatric medications.
Mhm.
And then how do we fill in those gaps, even for, immediate access to care or within a reasonable amount of time so that somebody doesn't have to drive an hour to get
Right.
access to quality behavioral health care
'Cause that could
services.
be a real barrier for families,
Definitely.
particularly if you have one car and it's
Yes.
through a mountain with no cell phone coverage, all of that,
Yes,
right?
yeah. And telehealth, I mean, with the pandemic, telehealth really exploded in our
Mhm,
country, and the same thing happened in Virginia.
mhm,
But it's appropriate and it's a great way as sort of a treatment extender, if you will. But there are just some times where it's not appropriate because you just
mhm.
need to be able to lay eyes on that person. And then to your point, there's some parts of Virginia where there's not the service to be able to stand up and provide, telehealth
Right, they don't have
services.
broadband and those kinds of things, that's
Correct,
tough, yeah.
correct, yeah.
Remote areas in Virginia, I mean, they really have a provider shortage, right, and resource shortage like
Definitely,
broadband.
definitely.
Help me understand, how are CSBs funded and how do they interact with your organization?
Yeah, so there's 40 CSBs in the state, and what I would say is each one of them, funding level is different.
Mhm.
Um, they're funded by a blend of both federal pass-through dollars, dollars that come from the state, dollars that come from their localities. Some of them can have fundraisers and
Mhm.
funded through sometimes local and federal grants, as well as billing healthcare companies for the services provide and by collecting copays from the individuals that provide services. So they really do have a real blended sort of weave of ways that they pay for the care
It
that
can
they
be
provide.
complicated,
It definitely
right?
is.
And they're run by the communities, or they're nonprofits? How does
So
that work?
so there are different types of community services board depending on
Mhm.
where you're at in the state. So there are 40. 9 of them are part of local government.
Mhm.
They're called administrative policy boards. Richmond has the One Behavioral Health Care Authority, and the remainder are what's called operating boards, which operate a lot like private nonprofit
Mhm.
agencies. And they are multi-jurisdictional often, not
Mhm.
just serving one county, but serving multiple counties and cities in
Mhm.
the Commonwealth.
Yeah. So it's so interesting. I think people just think that there are hospitals and communities,
Hmm.
but there are state hospitals that you run,
Hmm.
and there are these community service boards, and they all have to learn how to interact with one
Yeah.
another, and then they all have to interact with law
Yeah.
enforcement, right? And we all need to find more resource for all of them,
Yeah.
right?
Yeah. And I think the critical thing to remember is the private provider network are extremely important partners because they actually provide the bulk of the services, if you look sort of statewide, that are provided in the
Yeah.
Commonwealth. It's done by the private provider network.
Mhm.
CSBs serve a significant number of individuals, but, you know, we have to have every component of that system of care partnering and working together
Mhm.
if we're willing to take meaningful steps towards strengthening that and have it work better to serve Virginians.
And that really is a big part of your
Mhm.
focus, right? Is
Mhm.
coordinating
Yeah.
the resources efficiently so
Yeah.
that there's not duplication, but coordination,
Yes.
right?
Yes.
So important. These are things that I don't think people understand how this all works
Mhm.
and how important your role is.
Sure.
When you're out there, I love that you said, by the way, that you're trying to visit places that are the least like Fairfax. I love
Mhm.
that in concept, but what are you learning as you're listening to families? Any ahas or anything that you think others should be paying attention to or can help you with?
So I think, some of the things that I am learning is this um, the interaction between public and private partnerships is significantly different depending on what part of the Commonwealth you're in.
Mhm.
And the private healthcare systems, depending on what part of the Commonwealth and the resources that are available, not just in the public healthcare system, but also in the private, just is very significantly. And I really sort of think it really is going to take some type of regionalization of collaboration because what's
Mhm.
going to work in the Tidewater area and the healthcare systems that both public and private there may not necessarily work in the New River Valley area or in the
Right.
Northern Virginia
Yeah.
area. So I think we have to kind of work with these different systems, but then also allow enough flexibility
Mhm.
because we can't just take a cookie cutter approach to how we're going to
Right.
be able to improve both public and private behavioral health care in the Commonwealth.
I think that's so smart, and it's also respectful
Hmm.
to talk to that community and
Hmm.
listen to what they think about what would
Hmm.
work best where they live,
Yeah.
right?
Yeah.
I think sometimes we forget to do that when
Hmm.
we think we've got it all figured out.
Sure.
Yeah.
Yeah.
I love that that's your
Mhm.
approach. Do you feel like we have enough people in the behavioral health workforce?
No is a short answer. So there's a national shortage of behavioral health care professionals.
Mhm.
And what we're struggling with at the Department of Behavioral Health, the private providers, the CSBs, and even the private hospital systems. There's a shortage of everything from psychiatric nurses to, case managers to
Mhm.
name your prescriber, whether it's a psychiatrist, psychiatric nurse practitioners, physician assistants.
Mhm.
There's shortages at every level of
Mhm.
care and every professional level in the behavioral health care system.
Which is exciting in a way for young people who are looking for a path,
Yes,
right?
yes.
We care a lot about working in local communities with children in middle school, high school, and so forth to encourage them and
Mhm,
put in front of them
mhm.
healthcare professionals where they could see themselves doing
Yes,
that.
yes.
Um, we should all talk about that more because
Mhm,
I do think we need to encourage young people to go into this space. But if they don't see
mhm.
it, it's not in their community.
Mm.
It's hard to imagine doing it, I
Yes.
think.
It is, and that's actually to me even a larger challenge in the behavioral healthcare field because when you think about um, people shadowing other professionals or seeing
Yes.
things like that, people might think about the doctor's office in their community, or they might think
Right.
about the hospital in their community. They're not necessarily thinking about the behavioral healthcare clinic in their community
Right.
or the psychiatric hospital in the community.
Yeah.
So
Yeah.
we are doing active outreach to the
Oh, I love
schools
that.
and even trying to find a way to do that in high schools,
Mhm.
to introduce them to behavioral healthcare as a profession
Right.
and letting them know this is an option. You can make this not just a job, but a career.
Yeah. And so many different kinds of roles, like you named
Yeah.
so many.
Yeah.
And I think we think doctor and nurse, but there are
Hmm.
so many different professions here
Yeah.
that are needed
Yeah.
and can extend care.
Agreed.
Yeah.
Agreed. Yeah.
I like it. So if you had a magic wand and you could change one policy or one thing, what
Uh,
would you?
just one.
Okay.
Just
I'll
one.
give you 3 wishes.
Okay. All right. I think that it's not necessarily always about policy change. I think it's about finding new ways to collaborate with each other.
Yeah.
I we talked earlier about law enforcement, and I think if we could find a way to get the public and private behavioral health care providers in the room with law enforcement and hospital administrators, both in the public and private field, and I'm trying to recreate this right now and having kind of what I call problem solving sessions where I'm bringing the
Mhm.
people from all these specialty areas and having just sort of laying it on the table on what's working with our system, what's not.
Mhm.
And then if we could do a legislative change, what
Right.
would that look like?
Yeah.
If we need additional resources, what that looks like. And
Right.
then the other question I'm asking them is, if it's not something that the law says we have to do it this way, or the General Assembly says we have to do it this way or
Mhm.
something, and we've just always done it that way, ask them why, and
Right.
then can we change it so it works better for the
Yeah.
people we serve?
Yeah.
So I like that question, but I'm really having those discussions. We just had one yesterday. I plan on having some more over the next couple of weeks, sort of really looking at different parts of our crisis system to
Mhm.
try to find ways to problem solve.
Mhm.
Some of them are going to take some additional resources,
Yeah.
and some of them are going to be things that, maybe it's a legislative change.
Mhm.
And then also some of it is we just need to change what we've done and
Right.
do it differently.
Yes.
Yeah.
You and I have had other conversations
Hmm.
before today, and, we believe strongly at the Medical Society of Virginia that some things just need to be fixed, and sometimes that means just starting to do something new, just starting and trying. It doesn't have to light the world on fire, but let's
Hmm.
just try.
Hmm.
People who are in the trenches typically know what would work better,
Yeah.
and I think it's so smart of you that you're listening because I really think that's where solutions are found. People who depend on that system know why it doesn't work,
Yeah.
right?
I totally agree. I've learned that during my tenure of my career is, I walk around and I would talk with my frontline staff around
Mhm.
what's working, what's not working.
Right.
Um, sometimes didn't always like what I hear, but to me, that's what I needed to
Right.
hear.
Right.
And I think that's important
Yeah.
with leaders that, they
Yes.
take that time out to talk with the staff that are doing the work and
Mhm.
listening to them, and then try to take that back and to see what can we change to have our system work better because we're here to serve individuals and I say that, nobody walks into an emergency room in a psychiatric crisis because they're feeling good or
Right.
CSB.
Right.
I mean, often it's one of the worst days of their life. And then
Mhm.
how can we have that experience go as good as it possibly can, given the
Mhm.
challenging situation that they're
Yeah.
in?
Yeah. I think that's smart. It's interesting, and I'll just give some commentary here. I'm getting to know you. You and I have just met each other over the last few months. What I observe about you is that you are so open to people and you want to listen and you want to learn and you want to fix
Mm,
things, but you want to do it in a way that serves who you're serving versus you have something in mind where you're going to change their lives so you feel good about it.
yeah.
I think it's a form of humble leadership that I admire, frankly. And in this space in today's age is so important. And I think it'll be really effective. That's just Melina's
Hmm.
personal commentary on meeting you.
Oh,
I think where you are right now is the right place.
oh, I appreciate it. Thank
No,
you.
it's true. I think if people want to interact with DBHDS and want to partner, what's the best
Hmm.
way to start that?
Send us an email, give us a call,
Yeah.
just talk with us. Daily I get emails around what's working and then what's not working in our system.
Right.
And, some of those I answer directly, and some of them I triage onto my content experts because I
Right.
don't know all the answers, and I have to rely on my team that
Mhm.
know, more about some of these services because they are so unique and specialized.
Yeah,
Yeah.
I think
Mhm.
that's really important. I admire who you are as a leader.
Mhm.
I think it's an interesting thing. You're a quiet leader,
Mm.
and I think that's gonna serve you really well.
Oh, thank you.
Yeah, it's
Thank
true.
you.
I think it'll serve the Commonwealth well.
Mhm.
What's the one thing giving you a lot of hope right now that we can improve things and we can make it better?
I think the fact that people are coming to the table. So when I had
Mhm.
my problem solving session yesterday, I kind of said this to the group. I was like, you can always tell the interest in the issue by the number of name tags that are left on the table after people have signed in.
Yeah.
And there were hardly no name tags left on that
Ah,
table. So, I mean,
that's
I think
huge.
people were engaged
Mhm.
and having conversations and really trying to talking about what are issues in our system, but also
Mhm.
then having those conversations on if we could change things, well, why can't we change this or can we do this? And then even during breaks, people were coming up to me and say, you know what, I'm going to go talk to this hospital and we're going to try to do a pilot. We're not
Oh,
going to wait on
great.
this.
I love a
And to
pilot.
me, those are the things that bring hope because it tells me that, people are energized about trying to do something different, trying to
Mhm.
make the system work better because
Mhm.
they see the challenges that are going on, and behind each of those challenges are people that are having some type of psychiatric crisis that's
Right.
going on, that are in a tremendous amount of pain, and having those individuals not getting access to care as quickly as they need to
Mhm.
is a challenge that I think all of us are faced here in this system.
Mhm. I think sometimes people just need to hear that we can fix things,
Hmm.
that you believe it's possible, and that you're willing to be their champion when you
Yeah,
find the right solution.
yeah,
So powerful,
yeah.
so empowering.
Mm.
It gives me hope.
Yeah, I have that, and one of the things I've talked with my staff about and in multiple other settings is that, it would be great if we could just sort of have one big swing for the fences type of win and
Right.
things like that, but I'm also, a realist. I think that if you can have 20 small and medium-sized wins,
Mhm.
that can make just as much change, if not more change than one
Agree.
huge thing,
Yeah.
and to me, that's kind of how I'm looking at. I'm like, I'm fine with the big swing for the fences change if we can make that happen, but I'm also trying to approach it as in, okay, what are some other things
Right.
where we could maybe do a pilot quickly or make a change
Yes.
quickly or do
Yeah.
things like that, that maybe you don't notice it right away, but then after a year you look back and you've
Yes.
got 10 of those things going on, and those 10 things added together are really making a significant difference in our system.
And I think it creates momentum,
Hmm.
right? Momentum breeds bigger wins and more
Yes.
support,
Agreed.
which gets you up that hill to the big things too, I think.
Agreed. Agreed.
Yeah.
So,
I love it.
mhm.
Anything else you wanna share with anybody before we're in?
Those open-ended questions,
I
I should know
know.
about that as a therapist, but, sometimes they get me, when they was asking me things. I just think that, stepping in this role has been, tremendous learning experience for me, even though I worked 30 years in the public behavioral healthcare system, and I'm just grateful that I've got a great team that has been really partnering and welcoming me in, and that as I go out and talk with CSBs and hospitals, people want this system to work better.
They do.
They're frustrated with how it is working, and I'm really optimistic that by sort of energizing that wish to kind of want our system to work better, that we'll be able to truly have some things after some chunks of time that are working better within our public and private behavioral healthcare system.
Well, I think you're gonna get a lot of support,
Yes.
especially the more people hear you,
Hmm.
meet with you
Hmm.
and your team. So,
Yes.
thanks for all you're doing,
Oh, well, thank you.
and thanks for spending the day with JoyMed.
Oh, happy to be here.